Hi, I'm Christy Reimer with dvm360, coming to you live from CVC Kansas City. This week, Dr. Marty Becker helped CVC attendees take the pet out of petrified during Fear-Free Friday, a late-night talk show event hosted by CVC. Complete with music from the Fear-Free Band, an opening monologue by Dr. Ernie Ward, and tips from expert guests Margie Shirk and Tony Buffington, the evening highlighted specific steps veterinarians can take to minimize patient stress and anxiety during visits to the clinic. For example, Dr. Shirk wraps cats in a hot towel and conducts her exam on the floor with the cat's head pointing away from her. Dr. Buffington covers cat carriers in the waiting room to minimize visual stimulation. And Dr. Becker asks owners to bring dogs hungry so he can reward with treats during the entire visit. Visit dvm360.com/fearfree for more on this important new movement that's sweeping the veterinary profession. If you're planning a hospital building project, you can incorporate the fear-free approach into your facility design. Here's Hospital Design Conference speaker and architect Heather Lewis on how.
One of the best things they can do is to think a lot from a cat's perspective. We tend to focus on dogs as a society, but actually cats are by far the most freaked out in a veterinary setting. So anything we can do to think about their perspective in a veterinary setting is actually going to help dogs as well. One of the great examples is noise control, because cats are very afraid of noise in any setting, but especially in a veterinary setting. And that can be simple things, all of the basics that we've always talked about, such as building sound walls between major rooms in the veterinary clinic, or it can be very simple, such as putting a quiet latch on a cage. Most of the manufacturers now will sell a quiet latch that doesn't create so much clatter when the cage is opened. And those little things really count for cats.
Coming up, CVC speaker Dr. Stephen Divers offers a tip for practitioners who see exotic patients and need additional diagnostic insight. But first, you may know Sean McVeigh primarily as a veterinary management consultant who speaks at conferences like the CVC. But he's also a practice owner who has to deal with clients who complain about the cost of services. Here's his take on how practices can deal with these kinds of pet owners.
The consumer is making us segment our product whether we want to or not. If we look at hotels or restaurants, they're probably the best examples, or maybe cars are a really good cultural example. People decide what they want to buy, i.e. a car, and then they make a decision about what car or what product they're going to buy based on the money that they know that they have to spend. Because veterinary medicine has not segmented itself. In other words, we don't know the difference between a low-cost veterinarian and a highly trained specialist who charges $3,000 for a surgery. In the client's eye, that is all the same person. So we haven't segmented. If I go to buy a car, I know the difference between a Ford Fiesta and a Mercedes-Benz. One is not right, one is not wrong, it just appeals to a different market. So until we get better at segmenting ourselves and identifying our primary target, i.e. the customer that we want to come to us, we are going to always be confusing the client about the costs of veterinary services.
Hi everyone, my name is Bash Hallow with Hallow Tassiva Consulting, and you're watching the dvm360
My advice to general practitioners is that you've got this well-equipped practice, and even if you don't feel comfortable interpreting some of those results without assistance, you can certainly maintain these clients and provide them with a very worthwhile service by utilizing your skills and your equipment. For example, you can take radiographs of your birds and your reptiles and your small mammals, and you can get good quality orthogonal views. And then with the power of the internet and telecommunication, you can have those images uploaded, and you can get a specialty service. And there's a number of them available now. There's telemedicine services that will then provide you with a specialist interpretation that you can then charge and provide that to the client. And some of these telemedicine services will do that for radiographs. They'll also do it for blood work or even case consults. And so I think that's one way that practitioners don't have to reflexly refer these cases out of their front door. There's actually quite a lot I think they could do as a first opinion and make a decision with that client as to whether they then need to go forward with a referral. So I think that's something which I would like to see expand. I think it's got a lot of potential in practice.
Thanks for watching this edition of the dvm365 from CVC Kansas City. For more veterinary news, medicine, business, and team updates, be sure to visit dvm360.com every day.
Hej, mitt namn är Cecilia Friberg och jag är veterinär hudspecialist i Chicago och ni ser på dvm365.